Hello, everyone, and welcome to Medicare 101, Learning the Basics and What's Right for You. I want to thank the Gail Borden Public Library for hosting this event. My name is Andrea Norman, and I'm a licensed sales agent and Medicare Benefits Advisor with Ascension Complete AMITA Health Plans. I've been in the healthcare industry for over 15 years. Most of that time, I've worked with Medicare beneficiaries to help them find healthcare solutions that best meet their needs. I feel fortunate to be in a role where I can educate individuals about Medicare and make a difference in their lives. So again, welcome to Medicare 101, Learning the Basics and What's Right for You. Let's get started. So today we'll learn about the 4 parts of Medicare, your Medicare coverage options, Medicare supplements versus Medicare Advantage plans, and when to enroll in a Medicare Advantage plan. Now, there are 4 parts of Medicare. There's Part A, hospital insurance, Part B, medical insurance, Part C, Medicare Advantage plans like HMOs and PPOs, which include both Part A, Part B, and sometimes Part D, and Part D, which is your Medicare prescription drug coverage. Now, you do have choices when it comes to Medicare. You can have original Medicare A and B and add on a Medicare supplement or Medigap policy. You can also add a Part D prescription drug plan, or you can choose a Medicare Advantage plan, oftentimes called Part C, and add a prescription drug plan. Now, most Part C plans cover prescription drugs. You may be able to add drug coverage to some plan types if it's not already included. Now, let's do a deeper dive into Original Medicare. Now, Original Medicare is a healthcare option run by the federal government. It provides your Part A and or your Part B coverage. You can see any doctor or hospital that accepts Medicare. You pay your Part B premium. Part A is usually premium free because most of us have paid into it during our working years. You also must pay any deductibles, coinsurance, and copayments, and you can add Part D plan to add drug coverage. So Medicare Part A and B covers hospital stays and outpatient services. Original Medicare has a list of approved services and makes approvals based on medical necessity. There are certain services that Original Medicare does not cover, however. These include things like routine dental care, acupuncture, hearing aids, and exams for fitting hearing aids, vision and eyewear, and transportation. To get a complete list of exclusions, you can refer to the Medicare.gov website. Now, what are some of the costs associated with Medicare? Well, Original Medicare, you will pay a monthly Part B premium, the Part B deductible and coinsurance, and Part A deductible. Now, your Part B premium, for those of you that have been on it a while, you know that prior to 2020, you were paying $135.50. If as of 2020, you started paying $144.60, and in 2021, that went up to $148.50. Now, if you are a person who is a dual eligible, that's someone who has both Medicare and Medicaid. Medicaid usually pays that Part B premium. If you are a higher income earner, though, your Part B premium will be higher. And that would be based on your income being $88,000 if you're filing single, or $176,000 if you're filing jointly, and that would be based on your 2019 Medicare, income taxes. Now, let's continue and talk about inpatient hospital stays. Now, inpatient hospital stays are broken down into different benefit periods, and you can have more than one benefit period in any given year. But for days 1 through 60, if you're in the hospital, there is a deductible of $1,484. For days 61 to 90, you have a $371 per day copay. For days 91 to 150, there's a $742 per day copay, which includes your 60 lifetime reserve days. All days after 150 are paid by you. Now, there's also benefit periods associated with skilled nursing facility. For days 1 to 20, that's a $0 copay. For days 21 to 100, that's $185.50. And for all days after 100, all costs are paid by you. There's also a yearly deductible for Part B. That's $203. After you've met that deductible, there's a 20% coinsurance for most covered services, like doctor's services and some preventive services if providers accept assignment. There's a zero copay for some preventive services and a 20% coinsurance for outpatient mental health services and copayments for hospital outpatient services. Now, keep in mind for Original Medicare, there is no limit or maximum out of pocket to Original Medicare costs. You are responsible for coinsurance and copayment costs, regardless of how high those costs go. Now, let's do a deeper dive into Medigap plans. Now, Medigap plans are plans that are this is one of your options through Medicare, and you can add a Medigap to your original Part A and B. You can also add a prescription drug plan. Now, you would pay an additional premium on top of your Part B plan for your Medigap plan. So Medigap plans also have costs that depend on things like your age. Premium costs can go up every year as you age. It also depends on where you live, whether you're in an urban, rural area, and they also take a look at your zip code. Now, it also would depend on the company that's selling the policy. There are discounts afforded to women, non-smokers, and married couples. And it is medically underwritten, which means they take your health into consideration. And premiums may vary greatly from one plan to the other for the same type of Medigap plan. Important to note as well that Medigap plans do not cover prescriptions. If you want drug coverage with a Medigap plan, you must get a standalone Part D prescription drug plan. The Part D plan will have a separate premium that you pay in addition to your Medigap premium. So you will have 3 premiums to pay and 3 insurance cards to carry. Now let's take a look at Medicare Advantage plans. Now, Medicare Advantage plans are, again, one of your healthcare options. They're approved by Medicare. They're run by private companies. They're part of the Medicare program. They're sometimes referred to as Part C. They're available across the country, and you can get extra benefits through a Medicare Advantage plan. So how do these plans work? Well, Medicare Advantage plans can have medical and prescription coverage all in one. You receive services through the plan. All Part A and Part B services must be covered, and some plans may provide additional benefits, including dental, vision, over-the-counter allowance, transportation, and hearing. Most plans include prescription drug coverage. You may have to use network doctors and hospitals. Now, it does differ from Original Medicare, but they must cover all Part A and Part B benefits. The cost sharing, however, may be different. So again, you're still in the Medicare program. Medicare pays the plan every month for your care. You still pay your Part B premium. You still have rights and protections. The same services that are covered under Original Medicare will also be covered under the Medicare Advantage plan. You're also protected by HIPAA rules and regulations. If the plan leaves Medicare, you can return to Original Medicare and a supplement, or enroll in a new Medicare Advantage plan available in your service area. So now let's take a look at Medicare Part D prescription drug coverage. There are 4 levels or 4 stages. If applicable, for plans with a deductible, this is the amount you may have to pay before your drug plan begins to pay its share of your covered drugs. Then you move into the initial coverage limit. Your plan, you will only pay the plan's copay or coinsurance for covered drugs. You stay in this stage until your year-to-date drug costs reach $4,020 in 2020 or $4,130 in 2021. You would then, if applicable, move into the coverage gap or that donut hole. You pay 25% of the price for all drugs plus a portion of the dispensing fee, and you stay in this stage until your year-to-date out-of-pocket costs reach $6,350 in 2020 or $6,550 in 2021. You would then move into the catastrophic level. Moving into this level assures you pay a small coinsurance or copay for the rest of the year. That's 5% or $3.70 for generic, or $9.20 for all other drugs, whichever is higher. Your plan will then pay the rest of the costs for the rest of the year. Now let's look at some frequently asked questions regarding Medicare Advantage HMO plans. So, can you get your health care from any doctor or hospital? No, you generally must get your care and services from doctors and other healthcare providers or hospitals in the plan's network, except emergency care or out-of-area urgent care or out-of-area dialysis. Are prescription drugs covered? Yes. When you join an HMO, that includes prescription drug coverage. Do you need to choose a primary care doctor? In most cases, yes. Do you need a referral to see a specialist? Ascension Complete plans do not require referrals from your primary care provider. Other HMOs generally require a referral in order to see a specialist. Please check with your plan. Certain services like yearly screening mammograms generally don't require a referral. What else do you need to know about this type of plan? Well, if your doctor or other healthcare provider leaves the plan, your plan will notify you and you can choose another plan doctor. If you get healthcare outside the plan's network, you may have to pay the full cost. It's important that you follow the plan's rules. For example, the plan may require prior approval or authorization for certain services. Now let's talk about Medicare Advantage PPO plans. Can you get your health care from any doctor or hospital? In most cases, yes. PPOs have network doctors, other healthcare providers, and hospitals, but you can also use out-of-network providers for covered services, usually at a higher cost. Are prescription drugs covered? In most cases, yes. If you want Medicare drug coverage, you must join a PPO plan that offers prescription drug coverage. You may contact individual plans to find out if they offer prescription drug coverage. Do you need to choose a primary care doctor? No. Do you need a referral to see a specialist? In most cases, no. What else do you need to know about this type of plan? Well, PPO plans aren't the same as original Medicare or Medigap. Medicare PPO plans usually offer extra benefits like dental or vision services, but you may have to pay extra for these costs. So let's take a look at Medigap plans versus Medicare Advantage plans. So they're both offered through private companies. Medigap policies have oversight through the state, but must follow federal laws. The federal government has oversight over Medicare Advantage plans, and they must be approved by Medicare. Medicare supplement plans or Medigap plans work with original Medicare. Medicare Advantage plans work instead of original Medicare. Medicare supplement plans cover gaps in original Medicare coverage, like deductibles, coinsurance, and copayments for Medicare covered services. Medicare Advantage plans cover all Part A and Part B services and supplies, and may also cover things not covered by original Medicare, like vision and dental coverage. Most plans include Medicare prescription drug coverage. Both plans require that you have Part A and Part B. Do you pay a premium? For a Medigap policy, yes. You pay a premium for the policy and you also pay your Part B premium. For a Medicare Advantage plan, yes, in most cases, you may pay a premium for the plan and you pay for your Part B premium as well. So a Medicare Advantage plan does offer prescription drugs. So with a Medicare Advantage plan, your medical and prescription benefits are all together in one plan, making the process simple. You can have one premium, one plan, and carry one card. So Medicare Advantage plans also cover things not covered by original Medicare or Medigap policies, things like routine dental care, hearing aids, vision, and over-the-counter allowance. To get a comprehensive look at the things that are covered under Medicare Advantage, you can refer to the Medicare.gov website. So what are the costs associated with Medicare Advantage plans? Well, you still pay your monthly Part B premium. If you have access to state assistance, you can get this premium covered. You may pay an additional monthly premium, which varies by plan. Your plan may have deductibles, coinsurance, and copayments. It's different though from original Medicare, and it can vary from plan to plan. Often the costs are lower than original Medicare, and if you go out of network, you may pay a higher cost. So Medicare Advantage plans, however, limit how much you must pay for services in any given year. This maximum out-of-pocket means that your copayments and coinsurance have a limit. Once this limit is reached, the Advantage plan covers 100% of the costs of all your Medicare services. This limit can vary by plan. Some plans may set it higher to provide catastrophic coverage. Some plans may set it low so that beneficiaries quickly reach 100% coverage of their Medicare services. Now, who's eligible to join a Medicare Advantage plan? Well, you must be enrolled in Medicare Part A hospital insurance. You must also be enrolled in Medicare Part B medical insurance. You have to live in the plan service area. You have to be a US citizen or lawfully present in the US. Additionally, you must provide the necessary information to the plan, follow the plan's rule, and you can only belong to one plan at any given time. And unlike Medicare supplements, Medicare Advantage plans are not medically underwritten. So what are the times you can enroll in and switch to a Medicare Advantage plan? Well, there are certain timeframes per the federal government. The first one is your initial enrollment period. And keep in mind, again, you can only belong to one Advantage plan, and they're generally for a calendar year. But your initial enrollment period is a 7-month period that begins 3 months before you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. Keep in mind, if you delay your Part B enrollment, for example, if you have an employer or union coverage, your time to enroll in a Medicare Advantage plan may be more restricted. Next, there's the Medicare open enrollment period. This is from January 1st to March 31st. You can make a one-time like plan change. You must be enrolled in a Medicare Advantage prescription drug plan in order to switch and join a new Medicare Advantage prescription drug plan. There's also the Medicare annual enrollment period. This is from October 15th to December 7th, and coverage begins January 1st of the following year. There's also Medicare through disability. This period is a 7-month period that begins 3 months before the 25th month of your disability and ends 3 months after the 25th month of your disability. There's also a special enrollment period. There are many different types of special enrollment periods. Some of them would be if you move out of the plan service area, or if you lose your employer or union coverage, or you lose extra help. You can get a comprehensive list of the things that may qualify you for a special enrollment period by, again, contacting Medicare, going online to medicare.gov. So there are special rights that Medicare Advantage individuals have. One of them is a special Medigap right for people who join a Medicare Advantage plan for the first time. When you're first eligible at age 65, or you leave original Medicare and drop a Medigap policy. You can disenroll during the first 12 months, return to original Medicare, and have guaranteed issue rights to return to a Medigap plan. So some of your other rights are to get needed healthcare services, to get easy to understand information, to have your personal medical information kept private, and you can also have your choice of healthcare providers, access to healthcare providers' treatment plan, know how your doctors are paid, have fair, efficient, and timely appeals process and grievance process, and coverage and payment information available to you before services. And finally, privacy of your personal health information. So potential members have choices in how to receive those Medicare benefits. The key is to consider what option will work best for you. I want to thank Gail Borden Library again for their time. And I would like to thank you all as well. I think we skipped, but thank you so much. And please feel free to reach out to me. Oh, somehow we ended up on the different. Okay, all right. Well, I was going to share my information and it skipped. So yeah, my system is down, but my name is Andrea Norman. I'm going to stop sharing my screen here. My name is Andrea Norman, and I am a licensed sales agent and Medicare Benefits Advisor with Ascension Complete, AMITA Health Plans. My number is 320-9808. Again, that's 312-320-9808. My email is andrea.m.norman@ascensioncomplete.com. Again, that's andrea.m.norman, Norman, @ascensioncomplete.com. Thank you all and have a wonderful day. Stay safe. Bye-bye.